So let me now wrap up by talking about the most important aspect to many of you, which is where am I going to get the money? And I'm talking about money not just for venture capital, but before the venture capital period. Where are you going to get the money? So it turns out that raising capital has become both more complex and also lots more opportunities. And let me tell you the before and the after. Before, the way that money was spent and raised in the biopharma industry was according to this chart. This comes out of a Nature Biotech article written by people who are from the biotech industry. So this arrow represents the different clinical phases of drug development, R&D, preclinical, phase 1 through phase 3, and so on. In the old days, the people who funded R&D and preclinical were family and friends, angels, foundations, because nobody knew what the rates of return were in this area. And so they basically had to take a leap of faith and were willing to put money in at that early stage. Then, when you get into preclinical and phase 1, now venture capitalists are able to come in. And as you get later and later into the clinical phases, as it becomes clearer and clearer that you've got a winner, more and more investors start to come in, and bigger amounts of money start coming in. And all of this has to do with risk. The highest level of risk, if you think about risk as being on this axis, the highest level of risk occurs right here. At the very ideation phase, when you have no idea whether or not your particular approach is going to have any commercial value. So the risk is the highest, and that's one of the reasons why only a limited number of people are going to put money to work. It's because who knows what the rate of return is. As you get farther into your research and clinical discovery, the risk goes down. Each phase that you successfully conclude, the risk goes down. The really big drop in risk happens at the end of phase 2. If you get into phase 3, that is viewed as a very positive sign. A number of companies have already gone public by this point, and when you have a positive phase 2 conclusion, your stock price dramatically increases. And ultimately, if you get an approved drug, now the risk is very low. It's almost like cash. If you've got an approved drug, you can sell it for cash on the barrel. That's the old days. And the process by which investors put money in really dependent on this notion of de-risking, lowering the risk to the investors. But today, we now have a whole different ecosystem of money. And in particular, the new sources of money are family offices, foundations, venture philanthropy, patient advocacy groups, and even large pharma companies now have created incubators and university collaborations. We've got a number of them within walking distance of this building here. So today, there are many different sources of capital, and let me just list them for you. It really has to do with this idea of the risks that are involved in clinical trials. You've all heard about the inverse funnel, where you start with lots and lots of candidates for a drug, and now you get back to one at the very end. Well, that funnel has, based on the Sharpe ratio, an inverse of that, the amount of money that's available to invest in you. If everybody knows that you're going to be a winner, amazingly enough, lots of people are happy to invest. That's the Bernie Madoff Ponzi scheme, unfortunately. But when you have lots and lots of risk, only a very small number of investors are willing to take the chances, and you need to know who they are. So, NIH, NSF, SBIR, Department of Defense, DARPA, MassBio, these are organizations that are willing to invest at the very beginnings of your career and at the very beginnings of the idea. So you should get to know them, and they should get to know you. Philanthropy is another source, which has become a very valuable set of opportunities to be able to generate value and with investors that are really understanding of the risks that are being taken. Patient advocacy groups, another great source of funding. As long as your objective is aligned with the patient advocates, they're willing to support you. And in many cases, they're willing to support you with hard dollars. The Cystic Fibrosis Foundation has been famous for partnering with investors and biotech entrepreneurs to create drugs to help CF patients. So if you can find the right group, you can actually get tremendous support from that group for your research, even at the very beginnings of your process. And finally, I mentioned big pharma, but even biotech companies and clinical contract research organizations, CROs. These are the folks that actually go out and conduct the clinical trials. They organize them, set them up, collect the data, process them. They are now in the business of investing in young biotech entrepreneurs because they see ultimately that if you're successful, that's going to feed into their business pipeline. So these are all organizations that you ought to explore and be able to tap into.